Good morning, everyone. My paper for today's presentation is comparison of risk-palm ratio among person with and without carpal tunnel syndrome. Sorry. Good morning, everyone. My paper for today's presentation is comparison of risk-palm ratio among person with and without carpal tunnel syndrome attending a tertiary care center. As we all know, carpal tunnel syndrome is a common entrapment neuropathy resulting in the compression of median nerve of the carpal tunnel. This causes characteristics of symptoms like tingling, pain, weakness in the median nerve distribution. It can significantly impact hand function and quality of a life of a person. There are several risk factors such as occupation that involve repetitive hand movements, hormonal fluctuation, diabetes mellitus, and anatomical variation, which causes increase in the pressure in the carpal tunnel and thereby causes carpal tunnel syndrome. The structural differences in the wrist and hand anatomy can influence an individual's susceptibility to develop CTS. A narrow carpal tunnel potentially increase the risk of CTS. This work will explore the role of risk-palm ratio in CTS diagnosis and its clinical application. Renal studies is a common problem we encounter CTS, and it's a cost-effective and a non-invasive method that I am following. And it is easy to identify the individuals at a risk. And I am supplementing the existing diagnostic measures with the risk-palm ratio. I already have NCS and other measures to find out the CTS. The primary objective was to compare the risk-palm ratio among the person with and without carpal tunnel syndrome. And secondary objective is to estimate the relationship between risk-palm ratio and the snap of the median nerve in the carpal tunnel syndrome in patient. Study design was analytical observational study. The study setting was outpatient department of physical medicine and rehabilitation, Government Medical College Trivandrum. Study period was 18 months from the date of acquiring clearance from Ethical Human Committee. Study population was all consecutive patients attending PMR outpatient department diagnosed as a case of carpal tunnel syndrome and confirmed electrophysiologically. Equal number of participants with no symptoms or signs of CTS will be selected as control group. Inclusion criteria: patients who are willing to give informed consent, age group between 30 to 60 years, clinically and electrophysiologically confirmed case of CTS. Exclusion criteria: there is a history of prior fracture and trauma, history of carpal tunnel surgery, patient with generalized features of or neuropathy, a systemic disease that cause complications such as patients having systemic disease which cause neuropathy complications such as RA and hypothyroidism. Sample size was calculated, N is 36, and sampling was done. All individuals meeting the inclusion criteria and consenting to participate in the study are consequently recruited till the sample size was attained. Study instruments are semi-structured proforma, digital caliper, nerve conduction, NCS machine, measuring tape, weighing balance, and stadiometer. Study procedure is total number of 72 subjects were included in the study. In this, 36 was cases and 36 in the control group. And study subjects were asked to fill the semi-structured proforma, and which include the demographic details and the comorbidities. And thorough clinical examination and electrophysiological evaluation was done. This is normal values. And the measurement of the WPR, that is wrist depth, was measured at the distal palmar grease, and the palm length, that is on third metatarsal to the distal palmar grease, was measured, and the ratio was calculated by dividing the wrist depth by the palm length, and this was compared between the case and the control groups. And we also investigated the relationship between the wrist-palm ratio and the peak sensory latency snap. Results are: the mean distribution of age among the cases was 50.22 and among the controls was 51. BMI 27.03 in the cases and the control was 24.68. Occupation: most of the occupation was homemakers in the cases and the controls. As age and sex match, both the case and the control group contain equal number of male and female. There was no statistical significance between the comorbidities in my study and the carpal tunnel syndrome. The mean WPR among the cases was 0.405 and the control was 0.327. So when we compare the WPR among the cases and the control, there was a significance with the p-value less than 0.001. The mean snap latency among the cases was 4.08 and the controls was 2.88. When we correlation between the snap and WPR, there was a positive correlation between them with the correlation coefficient p equal to 0.463. Discussion. Coming to discussion, in CTS groups, most of them were female. That is, the female to male sex ratio was higher, which is higher than the literature we study. Maybe because of the low mechanization in our region, and the women are more involved in the job that require frequent repetitive hand movements are performed by the women. And in my study, most of them were homemakers, and the job that requires repetitive hand movements mostly. The mean age of CTS case of 50.22 years. There is a statistical significant difference in the mean WPR between the cases and the controls. In the cases, it was 0.405 and the control was 0.327 with a p-value less than 0.001. This that is shorter palm and thicker wrist are more prone to develop CTS. There is a positive correlation between the snap and the WPR. This correlates that higher the WPR, greater the nerve compression and decreased conduction. Summary, a statistically significant correlation was found between WPR greater than 0.4 and the presence of carpal tunnel syndrome. Additionally, a positive association was observed between WPR and snap peak latency. So I suggest a routine WPR measurement should be considered essential in the pre-placement examination for jobs that require repetitive hand movements. So it could help to optimize the resources for both the employees and employee. Moreover, individuals exceeding more than 0.4 WPR who engage in repetitive hand movements should undergo screening so that they can detect CTS early and we can prevent the complication that a person develops. Limitation is a small sample size. Its sample size is only 36. Large sample size is required for the validation of WPR ratio. It is a unicentric study. Large multicentric study may be solicited to increase the generalizability of the result. Thank you.
Nice presentation, Dr. Paul. You wanted to screen people before they are put on a job. But most of them are housewives, no?
In my case, it was housewife. But in case we are putting a person for a job that requires repetitive hand movements, we can screen them with a symbol. There's a non-invasive and low cost, no cost is involved. So we can screen them. So if the WPR ratio is more than 0.4, there is a potential risk that a person may develop CTS. So we can tell them, and also we can do an NCS if we want to detect the CTS early so that we can prevent them from developing complication. And it may help to save the resources of both the employees and employee.
You mean not to employ them or what?
Employ the time. The person may be absent if we are taking leave for some time, for a long time. So the employer, it will be difficult.
Hello. Very good presentation.
Sir, thank you.
Have you taken any X-ray cervical spine for these patients?
X-rays, sir, actually I did not only while doing NCS, sir, I do the median nerve NCS and ulnar nerve NCS to rule out other neuropathies, any compression neuropathies and all. After that only I will include them in my study. I will exclude all those conditions which causes generalized peripheral neuropathy in this condition from my study.
So did you say you calculate WPR by looking at the
Sir, I used
measurement at the wrist?
Wrist
divided by
palm length.
Palm length. Okay.
Yeah, palm length is, I have shown the figure actually. Yeah. The palm length is from third metatarsophalangeal joint to distal palm crease. I take the ratio. So from that ratio, I found that in the CTS person, it was 0.4, and the control group, it was 0.33. So it was a statistical significant difference was there actually. So I think there is a probable risk factor for developing.
Thank you. One more comment about screening before giving jobs.
Sir.
That's a dangerous territory. You know?
Sir.
You can also screen for genetic problems and so on. And so that's a very dangerous territory.
No. No.
Questions from the audience, please.
I also disagree with the screening program.
Sir.
So not only for job, for whatever purpose it is, because the screening will make the patient scary.
Sir.
So the early symptoms of CTS, they will come with the numbness in the hand when they do something, when they drive the two-wheeler or doing household work or squeezing the clothes or whatever it is. So the very moment they are coming with the numbness of the hand, we can do the necessary investigations or clinical examinations, find out any evidence of carpal tunnel syndrome, the very usually done test, valence test or reverse valence test, that will give you a conclusive evidence of whether there is CTS or not, in most of the cases. And if necessary, you can go for an NCS also. So screening is out of question. And I have a question for you. So what is your concept of this, the influence of this wrist palm ratio?
Sir, actually,
how does it work? How does it apply?
Sir, actually, there is palm ratio is small. If the wrist palm ratio is more than 0.4, there is a decreased space in the carpal tunnel. So that person can have an increased chance, there is a small space, and there can increase chance of compression of the median nerve, and it can cause us carpal tunnel syndrome.
You mean the diameter of the carpal tunnel will be less?
It can.
The depth will be less or the width will be less? Depth of the carpal tunnel or width of the carpal tunnel? Or both?
Sir, both depending upon depend.
And
this can also add to the current. We are having lot of diagnostic measures for detecting NCS, but this can add. I am not saying it will replace, and it can add just to find a diagnostic value to this. Already we are having lot of diagnostic measures to detect CTS, so it can add to this.
So this is not a question, I am just adding to yours, sir. There is no causality between either wrist ratio or the wrist palm ratio and CTS, but thicker the wrist and shorter the palm, they got a higher chance of developing carpal tunnel syndrome, especially people with a moderate and moderately severe BMI. That's all. Thank you, sir.